Hi. Uh, in fact, in the last class, I had been discussing regarding the Angina Pectoris, and that was from the book Comprehensive Pharmacy Review, this book. And today, I just want to continue that portion again. In the last class, I was discussing the definition and also the causes of angina pectoris, and I just mentioned the types of angina pectoris. There are four types of angina pectoris. The first one was stable or classic angina, and the second one is called unstable angina. Basically, we used to know these two types of angina, but now at this book, I learned additional two things. Number three is angina decubitus or nocturnal angina, and the fourth one is presbyteral angina or vasospastic angina or variant angina. So specifically, this will be the class for angina pectoris series number 2, and I will discuss basically on stable angina. So, by the name itself, stable angina means it is something connected with the stability. That means basically when the patient is stable, at that time there will be no discomfort. So, what is written here? This is the commonest form of angina. Yes, obviously, among the four types of angina, this is the most common form. Most of the patients who are having angina is actually having stable angina, and it is quite predictable. Quite predictable means it is having a pattern. The patient who is having angina pectoris, specifically of this type, they themselves can predict when this kind of episode will reappear again. It is to some extent related to exercise or physical stress, as well as emotional stress, and sometimes also related with overeating. So basically, emotional, physical, and these two things are mainly responsible for triggering this thing, and that's why the patient who is having this kind of angina can predict. So another thing is written, it is normally relieved by rest. As I have already mentioned, when the patient is stable at that time, there will be no discomfort. So to some extent related to the stability. So it means the pain or discomfort will be resolved when the patient is taking rest. Also, sometimes it requires nitroglycerin, particularly a medication that directly dilates the vessels, the coronary blood vessels, or both. That means the patients who are having angina pectoris type 1, this unstable angina, they may have the discomfort based on the physical stress or emotional stress, or sometimes due to overeating, but this will be resolved if the patient take rest, or sometimes if the patient take the nitroglycerin, or sometimes they need both. So when we are talking about stable angina, there are five things we need to consider. Five things. The first one is location of the pain. Yeah, the location of the pain, and also the second one is the quality of the pain, and third one is duration of the pain. So uh, quality actually denotes the intensity. How intense that discomfort is. Secondly, the location is also important, as we have mentioned in the previous class, it may appear at that point and then radiate into the arm, or sometimes even in jaws, shoulder, something like that. So the location is also important, and also the duration. How long it is happening. It is for 1 minute or 2 minutes, something like that. It is also important. So the next factor is, the next component that we need to consider while talking about angina pectoris, the stable one. So that factor is, that component is factors that provokes the discomfort. Particularly as we have discussed, physical stress, emotional stress, or even overeating may trigger stable angina. So the patients need to know the factors that actually promotes this kind of discomfort or provokes to some extent. this kind of discomfort, and also the factors that relieve, or you know and the factors that actually helps to resolve this discomfort. So 5 things. Number one is the location, then quality or intensity, then duration, then the factors that provokes, and the factors that relieves the discomfort. So another thing is written here. Pain has been referred to as, okay. So now the thing is that angina pectoris is more of a discomfort. This is not like a pain. I mean, it is kind of a squeezing, grip-like, pressure-like kind of feeling, suffocating feeling, heavy feeling. So that's why it is usually referred to as a discomfort rather than the pain. So pain and discomfort is a bit different. So this is a discomfort which is kind of a grip like, or a squeezing, and something like heavy or suffocating. So it's not actually a pain, it's kind of a discomfort which starts at that point and sometimes radiate to the chest or other portions. So another thing is written here, the anginal episode typically lasts for minutes. This is one of the important thing, that it is not like lasting for 2 hours, 3 hours, nothing like that. It just lasts for minutes. I mean, usually it lasts for 3 to 5 minutes. Sometimes it may extend up to 10 minutes, depending on the severity, I would say. So anginal episode typically lasts for minutes and usually substernal. Substernal means, basically this pain will or discomfort will start appearing at that point. Close to that sternum, I think so. But it has a tendency to radiate. Radiate means shifting from one place to another. So it has a tendency to radiate to the neck, to the jaw, epigastrium, or arms. So it will originate from here, substernum level, and then it will radiate. It will try to radiate, or having the tendency to radiate, to the epigastrium, jaws, neck, or arms, something like that. Characteristically, the discomfort builds to a peak. Well, it actually is not something like instantly happened. It gradually goes up. So characteristically, the discomfort builds to a peak, radiating to the jaw. I mean, when it is slight, you don't feel that kind of peak. It will be located at the substernum level, but when it get at the peak position. I mean, when that kind of intensity is going high, it will start radiating. So characteristically, the discomfort builds to a peak, radiating to the jaw, neck, shoulder, and arms, then subsides without residual sensation. So it will go in extreme position, then sequentially subside without any residual sensation. Normally related to the physical exertion, as we have already told, it is basically connected with the physical stress, emotional stress. So basically it is related to the physical activity or exercise, and the discomfort usually subsides quickly. I mean, within 3 to 5 minutes, the discomfort will vanished, will be disappeared, if the patient take rest. This is important point. So if a patient is having angina pectoris, which is stable angina, he needs to take rest for 3 to 5 minutes, and hopefully within these 3 to 5 minutes that pain will be resolved. And sometimes nitroglycerin is also needed. The thing is that along with the physical stress, if there is any emotional stress, it will aggravate the situation. I mean, in that case, the episodes, this anginal episode will be longer, like it will last about 10 minutes, not like 3 to 5 minutes. So based on the physical exercise, it will resolve with rest within 3 to 5 minutes. But if it is also assisted by the emotional stress, it will take longer than 10 minutes for resolution. The last one, the last information which is given here, stable angina is characteristically the result of a fixed obstruction in the coronary artery. So in the previous class we have already discussed that this is because of the insufficient oxygen. The coronary blood vessel which is obstructed or narrowed due to the atherosclerotic plaque or atherosclerosis. In that case, the oxygen supply or blood flow is reduced to that cardiac muscle, at the myocardium level. So ultimately, this stable angina or this classic angina is basically the result of a fixed obstruction. So that obstruction is fixed. That is the main message here in the coronary artery. So I think this is enough to talk about the stable or the classic angina. In the next class we'll talk about the unstable angina and also angina decubitus. It's kind of a weird name, angina decubitus, and also the fourth one, the presbyteral angina. So I think it's enough for today. Hope to see you in the next class.